today, as we continue these weekly briefings about everything that's going on within the COVID-19 crisis, today, again, I want to encourage you to go outside, see some sunshine. There is hope. There's good things going on. Lift your spirits. Take some time and check in on somebody you care for, because we're going to get through this when we get through it together, and that's one of the things I want to put out there. But also, like Psalm 37:3 says, trust God and do good. So keep maintaining your distancing and keep good hygiene. That's just good advice anytime. So I'm going to open up with a word of prayer, and then we're going to invite Charlotte to come and continue to give us an update. So let's bow our heads. Heavenly Father, God, we thank you for the protection that we've seen in this community so far, and we just pray that it would continue. God, I pray for our leaders, God, for Charlotte and her staff, God, everyone who is on the front lines of this. Lord, I pray especially for our healthcare workers, God, who are literally putting themselves out there for us, Father, to keep us safe, to keep us protected. And so, God, I pray your blessing to be upon them. Lord, be with us in this time, but be with us, our community. In the name of Jesus, I pray. Amen. Charlotte? Just touch the button on the bottom of that microphone.
Good morning, everyone, and we appreciate you so much for joining us with this live stream today. Again, we hope that we can provide you with some helpful updates and information as we try to battle this illness in our community. We'll get started with the first slide. At our first briefing session on February the 27th, this was the global picture with 42 countries reporting COVID-19 cases. In our third week of monitoring this pandemic on March the 12th, the disease had affected 114 countries. In the next map, you will see that now, as of yesterday, April the 1st, our global map looks like this, with 173 countries affected by the COVID-19 disease. In our next slide, as of 4 p.m. yesterday, the CDC had reported 186,101 laboratory-confirmed cases of COVID-19 with 3,603 deaths. The map shown at the top of your screen was from last week's session, and now the map that will be appearing has elevated to these levels. With the exception of the U.S. territories, you will no longer see the lightest color cases in the legend showing on the screen. Currently, South Dakota is reporting the least amount of cases at 108, and New York reports the largest numbers with 74,427 cases. And again, these numbers were as of yesterday at 4 p.m. As of 2 p.m., reporting from yesterday, currently here in Missouri, we have had an approximate 17,427 tests that have been conducted both through the state public health laboratory and commercial laboratories. Of those, 1,581 laboratory-confirmed cases have been reported in Missouri citizens. These numbers have grown in the hundreds each day this week. 18 Missourians have died from COVID-19, and 71 jurisdictions, either counties or individual cities, are now reporting positive cases. And you can see the map of Missouri with those current jurisdictions that are reporting positive cases. Missouri disease count by age is the next information that we will look at, and we continue to see, as the information comes up there, the age range of 50 to 59 still continues to show the highest number of cases at this time. This range does not necessarily reflect that the age range has the most severe illnesses, as we know the older population and those individuals with underlying health issues remain most at risk for severe illness. Over the past several days, we have been reporting that being able to provide accurate testing numbers is becoming difficult. In the next slide for Laclede County, we know that due to the workload of our healthcare providers, some have chosen now to only report positive cases rather than all cases that they are dealing with. We do understand this decision. Their workload is growing with each and every day, but we want our public to understand this as well. The numbers that you will see and hear will not be accurate counts of all Laclede County residents tested, again, because in the coming days, we may only be receiving just positive cases. So here's where we're at here in Laclede County. This was as of just a few moments before we came for the live stream. We now know a total of 54 individuals have been tested. These are Laclede County residents. Of those, 42 are negative, 0 still remain positive, and we currently have 12 pending. What will be accurate is the number of positive test results, as healthcare providers and laboratories are required to report those to our agency. We do want to make a clarification because this has been a question that we receive quite frequently at the health department. If an individual is tested outside of Laclede County, so for example, they travel to a joining county, county's healthcare provider, and they are tested outside of Laclede County, we will still know when those results come back if they are positive. It does not matter where an individual is tested, it's the county of residence. So we want to make that very clear to our county residents that they do understand that. So while you may travel outside of Laclede County for testing, we will still receive those positive results. So it's the county of residence. Some of the disease specifics that we would still want our community to understand and remember, the signs and symptoms. Initially, most individuals will have fever and cough. As the illness progresses, individuals can start to experience shortness of breath. The incubation period, we know that is anywhere from 2 days up to 14 days after exposure. The younger and healthier individuals may experience more mild symptoms, while older individuals or those with other health issues can experience more severe symptoms. And as we've seen, this disease is taking the lives of many patients. Health experts now know that individuals are most communicable or contagious when they have symptoms. However, we want the individuals to understand that someone can be shedding the virus before their own symptoms begin or without symptoms. When we talk about and stress the need for social distancing, this is why. At this point, we do not accurately know who is able to spread the illness. Our recommendations that we still continue to provide for our county residents, the first would be wash your hands thoroughly and often. Keep your hands as clean as possible with hand washing and hand sanitizing. Keep your homes and businesses clean and sanitized as well. If you have a mild fever and or cough per direction from healthcare providers, these can be managed at home. You necessarily do not need to seek medical care with your provider or through the hospital emergency department if your symptoms are mild. Please try to manage those at home. We do encourage you, if you have questions, contact your healthcare provider, but you necessarily do not need to go into their facilities. If you do begin to experience shortness of breath, this would be the time to seek further medical care. Unless you have essential needs to take care of, now is not the time to be out in public. We know that many of you are listening to our requests and orders, and we greatly appreciate the efforts that you are taking. You are the ones listening and helping to protect our community. Unfortunately, we know that there are too many that are not listening, and I'm not talking about those that have to work. We understand that. Just yesterday, we received information that one of our largest retailers was crowded with people. Folks, this is not acceptable during this health crisis that we're facing. We're asking you, please stay home if at all possible. We have had a couple of questions over the last couple of days at the health department that I felt that I needed to make sure that we covered today. One was a question regarding our WIC program. The question was, what if my food voucher has a certain number of items available to me, but the store is limiting quantities or the store is completely out of that specific item? The answer is our staff has been given approval to issuing smaller quantities on food vouchers to help with these food shortages. For shortages on infant formula, you can request from the store a form called a partial redemption form that can be filled out at the form and brought to the WIC office, and we can issue more formula at a later date. This is only for WIC formula. It does not pertain to other foods. But if you are having an issue obtaining your WIC formula, please know that that is available. And if you have other questions, you are more than welcome to call our WIC office at 532-1271, and they can help guide you. Another question that we have been getting over the last couple of days deals with our faith-based community. And in the next slide, the question that we have been asked is about drive-in Easter services. Many of us are missing our normal church services, and I am certainly included in this. Our churches have done a wonderful job in providing alternate options for their members through many Facebook Lives. Although we have heavily considered the many requests we have received about drive-in Easter services, we cannot give our approval due to the hundreds of people that could be potentially exposed. Even with the best logistical planning, there are too many areas of concern. We ask that our churches continue the wonderful options given to us through social media live messages. During these uncertain times, we need the words of encouragement and continued faith that we will get through this situation. And I can't thank our local churches enough for providing that for us. In my last slide, I always want to provide sources of information for our community residents. The CDC website is still an excellent source of information, so cdc.gov. Also, the State Health Department at health.mo.gov/coronavirus gives wonderful updates and resources. They also are still operating their Missouri 24-hour hotline at 877-435-8411. And here at the Laclede County Health Department, you are welcome to call our office at 417-532-2134. We also provide updates on our Facebook page, and on our website there is an option for you to email questions. And if you would have questions, we are trying to field those questions as quickly as possible. So you can go to www.lacledecountyhealth.com, and we will try to make every effort to get your questions answered as quickly as possible. I do know that we have staff back at the health department during this live stream that are trying to answer questions as well, and we will try to get those answers to you again as quickly as possible. We do have some wonderful community partners here today, and I am going to turn the mic over, I believe, next to our Mercy Hospital Lebanon representatives and let them talk with you a little about what's going on over at the hospital.
Thank you. Well, thank you, everybody. I'm Judy O'Connor Snyder. I'm the Executive Director of Nursing, and I have with me Jennifer Myers, who is our infection control nurse here at Mercy Hospital Lebanon. I want you to know that we've taken lots of steps during this time. Over the last 3 weeks, around the clock, we've been working with our partners in Springfield, St. Louis, Oklahoma City, as well as Arkansas. We have conference calls actually all day long regarding this. We feel that we do have subject matter experts that are on these calls. We have infectious disease specialists that are guiding our moves here in our community. So we are really blessed to be in integrated health systems helping out with this. So lots of things that we've been doing. Number one, We screen every employee that comes to work every day. They have to be screened at the door just to make sure that safety is being provided in the hospital. We also have a no visitor, as we know that there's sometimes and important times that we need visitors, and they are screened as well. Obviously, we have our mother babies that they want their dads to be there. I get it. If we have end-of-life things, we take those into consideration too. But I want you to know that we provide safety for all. We've also included, if you drive by our hospital, we have a big trailer out front. We will go live Friday with that. It's called Forward Triage, and that is for our patients that are seeking emergency services. How that is set up is that patients do not even enter the hospital. They can drive up, they can be screened from their car. If they are symptomatic, they will be segregated within the trailer out front. And also we do have a pathway that if we do have a more serious patient, we can take them into the back of the hospital that goes right into a negative pressure room, which is especially for our coronavirus patients. They don't even enter the hospital through the normal door. So I want to assure you with confidence that we're set up to deal with this. I'm so excited about that. We've also decreased some of our services. We are only doing urgent emergent surgery cases, and there's a whole protocol that goes with that. So our surgeons are only doing that. That means that someone, if their health is in danger within the next 4 weeks, that is taken into consideration as well. We've decreased our outpatient services. If it's diagnostic radiology testing, we take that into consideration, and they won't be scheduled at all unless it's urgent or emergent. We've also, our cardiac rehab, unfortunately, has had to shut down at this point in time because of our age with that, and we need to take safety precautions. So with that, I don't think I have anything else to talk about. We are open if you would like to call the hospital. Again, my name is Judy O'Connor Snyder. I've fielded a lot of questions. They call me Nurse Judy from the hospital. Happy to answer any of them. We want you to know that we are prepared for this at the hospital. We have great coworkers. We have great physicians, and we're proud to be part of an integrated health system that can help us out along the way. Who should I? I'm going to turn it over, and we're going to get a clean microphone here. Thank you.
There we go. And I do not work microphones. I'm Mayor Jared Carr of City of Lebanon, and it's my honor to be in front of you guys here tonight, this morning. And this is such a unique situation that we have in our community, and such a hard time. And I know the health department is working their tails off, and as well as Mercy, and I appreciate them being here as well. All that's changed in this week from last week's report is that I do want to make the announcement that with the support of the health department, we are going to have a special meeting of City Council on Friday night at 6 p.m. in order to entertain a motion to have a stay-at-home order for the Lebanon community. We feel that this is the best direction for our community and to stay ahead of this curve. And want to ensure that our residents are as safe as they can be, and for now and in the future. And hopefully, like I said last week, hopefully we can keep our number at 0 right now. And I know we don't have a confirmed case here in Laclede County, but I think we would be fools to say that it's not here. That it's knocking at the doorstep, and we want to be in the forefront and do what we can to mitigate this as best we can as a community. And I know that working together and working with all of our industry partners, with all of our church partners, with the health department, as I mentioned, with the county, and with all of our different organizations throughout the community, I really feel that we are into this together, and I feel that working together is how we're going to get through this and come out on the other side stronger and a better community for that. So just a note on that, that will be Friday, that City Council will convene tomorrow at 6 p.m. So that is all I have.
It's on.
Good morning. I'm Randy Anks, Laclede County Presiding Commissioner, and I'd like to reinforce what you've heard here this morning. In this room, you have the individuals who are at the front line, who are making difficult decisions on a daily basis, if not an hourly basis, and they deserve a great deal of our gratitude. Collectively, we will make our way through this. And we're very fortunate this time that we've not experienced any negatives. But what will wake us up? You've heard our speakers this morning talk about doing our part. We've stressed from the county that this is very urgent. We know people are listening, but then we also see examples throughout the community of situations where we do have groups gathering, and we do have local retailers that have taken some preliminary steps, and I know they're doing more on a daily basis. But really it does come down to what are we doing as individuals. We are all of us are in this together. And I'm going to plagiarize something, what I heard this morning. We're all in this together apart. And we have to do, each of us, what we've been asked to do. Each one of these professionals in here can stress to you, but what will wake us up? Will it be that first positive case? Will that be what all of us then stop and realize that this is serious when it really hits home? So I want to encourage everyone to do your part. That's my hat that I wear as county commissioner. But another hat I wear is as a small business owner. And I hear a lot of concerns out there from the small business community. And I want to reassure them that by our very nature, we're entrepreneurs, we're risk takers. We didn't open our doors on the first day and things were given to us. We're going to come back from this. We're going to experience some very temporary loss. And that's frustrating. It's disappointing. We want to go to work every day. We want our employees to be there every day. We want to be able to continue to provide the goods and services that this community needs at this time. And so I'm thankful for the small business community. I'm thankful for our manufacturers out there that now have stepped up and they found a way to make products for this current COVID-19 situation. Just the other day I heard or seen a headline that Walmart, and I don't know if we have any Walmart representatives here, but Walmart was actually thinking about employing a one-way system in their stores. You would shop through the aisles, and I thought, what a great idea. We see businesses with drive-throughs. We see businesses with curbside pickup. There are many things we can do as small business owners, and we should be doing on a daily basis. We have to do our part as we go about what we normally have considered a typical day. I wake up every morning not making plans beyond what will I be doing in the next 10 minutes or 15 minutes. All of us have had to make those sacrifices. And then again, from the small business community, there are going to be resources. Our government has stepped up, and there's a CARES package out there. And that's going to be available to small business owners as early as tomorrow. So I encourage you to reach out to your lenders, all of our financial institutions here in Lebanon and Laclede County. Daryl Pollack, our chamber director, has a lot of information, so if you have questions, please reach out to the chamber and Daryl so that we can give you this information. I understand he's going to be the next speaker, so I'll stop with that. But remember, we are in this together, and if we, as individuals, don't do our part, it's going to be much more difficult for us to get through this and get to the other side and to be able to resume what we hope will be a normal day for us. So I just encourage each of us to stand up, do our part, and I'm grateful for this community and those leaders here and those professionals that do everything they do every day to make this a safer community. So Darryl, I'll hand you the mic.
Thank you, Randy. And I want to again thank LifePoint for doing this live feed today for our community. It's been a challenging last 4 to 5 weeks, and as I heard earlier, we began this in late February, and we continue to do this, and this escalates, and it's unfortunate that we are in the middle of this, but we are working together, and that's the key part of this is we are working together, come together as a community. I appreciate Mercy and the proactive stance and the things that they're doing out there that will be a benefit to our citizens. So we appreciate that. I want to thank the Laclede County Health Department, City of Lebanon, Laclede County, all of the stakeholders that are going and going above and beyond in these challenging times, and it is a very challenging time. So our presiding commissioner, Randy Yanks, alluded to a CARES package that was adopted and signed into law by our president, and this is a emergency reaction to keep small business workers employed during this pandemic and economic downturn. And so I'm going to real quick just say that how you can and it's very important if you're listening today or you let someone know that is maybe a small business owner of up to 500 employees. Time is relevant here. The Small Business Paycheck Protection Program that was adopted by Congress and is now about to go into effect locally is that this will provide small business funds with up to 8 weeks of payroll cost, including benefits. This loan can be fully forgiven. There are some details into this, but and how much you can borrow, and these are better explained to you by your banking institution. But I just wanted to throw this out this morning that part of these things are if the loan is fully forgiven, you must keep your employees on the payroll for a amount of time. All small businesses are eligible. This includes nonprofits, veteran organizations, self-employed individuals, sole proprietorships, and independent contractors. They're all eligible. Businesses with more than 500 employees are eligible in certain industries. So when do you apply? Starting April 3rd, that is tomorrow. Small businesses and sole proprietorships can apply. Starting April 10th, independent contractors and self-employed individuals can apply. Here's the key. We encourage you to apply as quickly as you can because there is a funding cap. As you can imagine, $350 billion sounds like an entire lot amount of money. But as it goes across our nation and the small businesses that would be potentially make application, it's very important that you get your application in. If you're listening and you want to do this, here's how you can do this. You apply through any existing SBA lender or through any federally insured depository institution, federally insured credit union, and or farm credit system institution. The Paycheck Protection Program is implemented by the Small Business Administration with support from the Department of Treasury. Lenders, if they're listening as well, and I'm sure they're up to date, but if they're not, you can visit SBA.gov or coronavirus.gov for more information. The Chamber encourages small businesses today to contact your local financial institution for application for this CARES Small Business Paycheck Protection Program. Again, it's very important. This includes nonprofits, veterans organizations, self-employed individuals, sole proprietorships, and independent contractors. They're all eligible. If you are looking for additional information and you'd weren't able to catch all of what I had just shared, we do have this on the Lebanon Area Chamber of Commerce website under the coronavirus 19 button. You can hit it, and a lot of this information you can just read for yourself. But I encourage you to contact your local financial institution for application today. Thank you.
Thanks to everyone. I'm Brian Armstrong with Laclede Emergency Management Office. We will be continuing our information every Thursday at 10 a.m. We will be communicating with all of our shared partners in which have spoke here today. And we would like to thank everyone that has come in and given their information. We will be here for information for anyone. If they have questions, they can contact our Laclede County Health Department, our county commission, our local city, and all of our medical fields. At this time, that will conclude what we have information for today. We would like to thank everyone for being here, and we will talk to everyone again next week at 10 a.m. Thank you.